So one area that we often get asked about is about parasites in stool. And I promise there's not going to be any gross photos here, but it's possible to have parasites in stool, but it's not common. This question was posed to a private group online of 64,000 physicians, and they had a photo attached to it, and it was a fairly believable looking material that looked like it could have been a parasite to an individual. And I think to a lot of people it does look like parasites. And you can do a Google image search of parasite in stool versus mucus in stool and see how similar they look. I wanted to share some comments from that group of that photo that looked to be representative of a stool sample. So one person said, send to pathology and do an ova and parasite test of concern. And that's the main test that you would do to determine definitively if somebody does actually have a parasite in their stool. Somebody else said, a love sushi prompt would orient my modest parasite knowledge towards Phylobrotherium latum or Anisakis simplex, but looks more like mucus to me. I'd say mucus, a Google image search of stool rope, if you want to see a bunch of tapeworm looking mucus, not a fun Google image search. Somebody else said, doesn't look like a worm, helminth, but you could submit it in a sterile cup to microbiology for a parasite exam if concerned. A pathologist said, this is mucus, you can send it to path, it's almost never a parasite, and the most convincing fake parasite mucus rope looked a lot more convincing than that. Another person said, fish tapeworms are flat and have proglottids, which are just the divisions between each section of the body. You can Google search that. This mucus string does not. Also, all sushi in the country is frozen first, which kills tapeworms. I might go get sushi tonight just to be ornery, and this is PEDS infectious disease. Infectious disease specializing in tropical medicine says, agree with the post that this does not look like a helminth parasite of any kind, and it looks like a typical mucus cast. I typically don't bother sending to path or micro, but can't hurt, so go ahead and if you prefer. I see these regularly in clinic and I've examined many of them myself with a microscope. Fun stuff, just hold your breath. As a note, it appears some herbal treatments actually promote casts. And I have seen some patients prescribe naturopathic herbal meds such as wormwood for parasites, and then when they pass the mucus cast, they were told that the treatment causes them to pass the worm. So take all of that into consideration when trying to determine if you have parasites in your stool.